We represent some of the states that are hardest hit in the country by the epidemic. New Hampshire is second only to West Virginia in terms of the percentage of overdose deaths in the country. Last October, President Trump stood on a stage in Portsmouth when he was campaigning for president, and he declared that if he were elected president, his administration, and now I'm quoting, will help all of those people so seriously addicted, we'll get them assistance, we'll make sure they have the top treatment and get better, end quote. He repeated those promises whenever he was in New Hampshire, a number of times throughout the general election. But unfortunately, we're 4 months into this new administration, and so far, President Trump has only put forward policies that would be enormous setbacks to state and local efforts to turn the tide of this crisis. And the greatest threat that we're seeing comes from the so-called American Health Care Act that was passed by the House. This is legislation that decimates Medicaid expansion and gets rid of the requirement that insurance plans cover substance misuse treatment. So it would essentially take a wrecking ball to all of the efforts to address treatment for the opioid epidemic in New Hampshire. The two parts of the Affordable Care Act that have been most successful in helping us address this epidemic are that expansion of Medicaid that provide coverage for people with substance use disorders, and the requirement that mental health treatment has parity with other diseases. Now, this couldn't come at a worse time for us in New Hampshire, where we had a 9% increase in opioid overdose deaths last year, and we're beginning to see deaths from carfentanil, a drug that is 100 times more powerful than fentanyl, than heroin. With the emergence of carfentanil, we could potentially see the beginnings of a new, even more tragic chapter in this epidemic. It would turn back the progress that we've made. Now, as I said, I'm delighted to have my colleagues here because everyone here has been working equally hard to address this epidemic. But before I turn the podium over to Senator Whitehouse, I want to just point out that the other concern I have with what's being proposed by this administration is the dramatic cuts to both the high-intensity drug trafficking area program and the Drug-Free Communities Grant Program, which are both part of the ONDCP. These are critical tools that states like New Hampshire are using to make a difference. And what this administration is doing is proposing dramatic cuts, maybe even elimination of that ONDCP office. So that's why Senator Hassan and I are introducing legislation today to protect the office, to reauthorize it for 5 years. Our bill, I think, is very important as we look at the programs that are operated out of what is known as the Drug Czar's office to help states like New Hampshire. So thank you all, and Senator Whitehouse.